Well, hi folks. Yeah, I wanted to just make a quick update because it's been so long since I posted or videoed anything. So I just wanted to make an update just to say how things are after so long, really. Well, it's kind of like Groundhog Day in a way, because I'm living with the same symptoms every day, really. I don't know if other people have heard of it or know my story, but I'm living with this infection for over 3 years now. I don't know if it's a viral, bacterial, or what type of infection, I don't know. Just over 3 years ago, actually, it's when I first contracted the disease. And I was quite well before that. I was relatively physically well. I did 12-hour shifts for 4 days in a row in a factory. So I did a fairly physical job, and I had to give up that job. And then I was able to work the next 2 years with the infection part-time. It was in my neck, and it still remains there, and around my head, in my membranes, that causes headaches and swelling. And so that remains my main problem that I've got with it, really. And then about just over a year ago, the infection that had been in my lungs and my neck and around my head, causing me the inflammation that causes the headaches that I get every day, that then spread to the lower part of the body. The infection became pleuritic, and so I started getting lower body pains sort of around the stomach area, not actually inside but around the stomach. Just to go out, it causes a lot of pain now. It's uncomfortable, it's difficult to manage even at home, so I restrict my movements and only just go out if I really need to. I've just been out today to the pharmacist just to get some medication there, just to stock up on it, because some days I feel unable to go out. What I'm living with is some sort of organism, whether it's a bacteria or virus, some sort of living organism that is growing and living inside my body. It's been in my neck and around the membranes in the actual head, in the muscles of the head, for 3 years now, and it progressed over a year ago when it spread to the lower part of the body, around the pelvic region. And so for the last 6 or 7 months, the pains have progressed of it, because it's a living organism within the body. It's excreting all this mycotoxin, all this mucus, and that excessive mucus that it's producing every day, I'm then having to clear out, and it's causing me the headaches and the neck ache. I can hardly support my neck a lot of the time, so I spend the majority of my time propped up in bed or in a chair, having to rest my neck against something for support, because my whole neck will swell out with the inflammation, and the head does too. And so that's causing daily headaches as well as the neck pains. And then the lower body pains over the last year have increased and gotten worse as well. It's made everything, even simple things, a strain, really. And I've become virtually housebound. I can go out, but it's a great effort. It causes a lot of pain, a difficulty, it's a lot of strain. I'm spilling out mucus out of my eyes, out of my nose all of the time. It's cleared up right now, there are intermittent periods where it sort of is lesser, and other times where it just literally pours out of my eyes and nose, and I'm bringing up large amounts of the phlegm. It's pretty yucky and pretty horrible as well, and it's easier to sort of manage the condition better at home, really. And as it's progressed and the pains of it have gotten worse, that's why I've spent the last few months more at home, really. So for about 2 years, I carried on working with it. I changed my job. I got a less physical job in a kitchen as a kitchen porter. I still went out occasionally with it then. Although it hurt, I was still able to, because the pains hadn't spread so far in so many places in the body. It wasn't in the lower body for the 2 years. I was just getting the headaches, this neck strain, and the lung aches as well. But with the additional lower body strains on top of that, it's made going out even harder, really. So I've really limited going out to just bare essentials for food, medicine, and sometimes I'll spend a whole week at home and I just, in desperation, just go to a local park that's just a few hundred yards around the corner, or just to go out somewhere for a change of scenery, because it's not good mentally or emotionally to be in the same place for so long. And I don't have people visiting that often, so it is nice just to go out and do something different. But it's just that I don't enjoy it. It causes a lot of pain and additional stresses, and so it's a very, I'm sad to say and report, it's a difficult, progressive situation here. Things have gotten a lot harder, and I've been able to go out a lot less over the last, I haven't been able to go out socially or in any educational way. I haven't gone out as any kind of part of a group or learning or working, not for a long time now, not in a regular way. That stopped quite a few months ago, really. So since then, I have just been trying to cope and manage with it as well as I can at home, really, and just dealing with the symptoms of it. I am utterly overwhelmed with it. I have never broken down and cried on a regular basis every week with it. What I do is I numb myself to the pains all the time. So I'm tranquilizing myself up. I'm dosing myself quite on high medication with strong side effects that make me quite lethargic, quite slower, quite tired. But I am all those things anyway because of the overwhelming symptoms of the actual infection. Because it's in the lower body, in the lungs, in the neck, and around my head, in the meninges, causing the headaches, the eye aches, the nose blockage, and all the pain around the back of the head, as well as the head and the neck too. So it's causing a lot of excessive pains. It does fluctuate. It's always in pain if I move it. If I stay still and restrict my movements and just stay propped up in bed for a while and find a comfortable position, then I can cope with it. But going out and doing excessive things on top of all that, sadly, as the months have wore on, they haven't yet been able to find the actual type, the strain of infection. So I've never yet been able to identify or to diagnose, to know the actual type. I don't know the strain or the type of infection I'm living with. That's worrying because it's grown and it's spread over the last few months. Over the last 3 years, it was quite stagnant and had very similar symptoms that remained quite consistent for a couple of years, where I was still able to go out quite a few days of the week. I could walk part-time. I worked part-time as a kitchen porter for those 2 years when I wasn't furloughed off for quite a lot of the time, really. But I still went out and did daily exercises regularly. I went out to a vigil, I went out to see a group, and I went out to occasional things. I was able to still manage the pain in that because it was just in limited areas of the body. After it spread over a year ago, I still was able to go out occasionally, but that became more irregular as the months wore on. And this year, it's become so irregular that I really don't go out and see other people. I'm not able to sort of go out and socialise. I don't enjoy being out at all. It's a difficult struggle managing the symptoms when I'm out, making sure, because I'm spilling out all this mucus, there's a stream of it coming out of my nose, my mouth, my eyes, when the infection flares up, where the inflammation is bad. But then occasionally I have to go out on that if I really need to get medications, or I've been at home for quite a long time and I feel desperate and I just feel I put up with the pain. I go out just because I need to just get out of the house sometimes and feel some fresh air and get out of that room. I feel like a prisoner to it, really. Although it's a very lovely, comfortable room, and my housemate's been very kind. He's cooked for me regularly, and fortunately I've had access to food there, and there's been heating over the winter. It's a very comfortable room in that, and I've had clothing, and I've been able to sort of do the basics and to wash and do a little cooking. My housemate's cooked regularly for me, and that's been kind of him. And I've been able to sort of cope with the symptoms, resting with it at home. If I really restrict my movements and do little, then I can cope with the excessive pains that I'm experiencing as the illness has progressed. I'm comfortable coping with it, but it is a strain still. And I'm not finding any way of coping and treating the actual disease as it is yet. It hasn't yet been diagnosed. All I've been able to do is just find ways of trying to cope and manage with the symptoms. And as they have progressed over the last year, when it progressed a year ago when it became pleuritic, and then over the last 6 months, it progressed becoming worse. The pains became increasingly longer and in more places of the body. So it's been harder to go out that often, and when I have gone out, it's been harder then to manage. It's a very challenging and difficult situation. I've never been in a situation where I've carried a disease that has grown that far, that much. This is a new, uncharted territory for me. You know, I'm scared. I don't know how it's going to progress. I don't know what it's going to do. I find myself breaking down sometimes in tears, the worry, the fear of it. Because it's an unknown disease and I don't know, even though it's been quite consistent and the symptoms have remained the same for quite a long time. Well, they did for 2 years, and then it suddenly changed when it became pleuritic. There was a sharp stabbing pain in the body that gradually receded over a few weeks, but the pains in the lower parts of the body that then emerged have remained and spread since then. And that's put an additional strain on me being able to bend, to stretch, to move, to toilet, to walk, and to do lots of other things that I was able to do before the disease had spread. And I'd never had any of those lower body pains around the pelvic region. When I was able to go out, to meet others, to go to a weekly vigil, to do 30 hours kitchen porter working, and I went out to protest, to a few parties, to a few gatherings, and to occasional gatherings and to events and things when I thought it was necessary. I was able to tolerate and manage the symptoms then in a way that I've not been able to do over the last 4 or 5 months. Since it's progressed and spread, no new treatment has been found, and I've also found no new ways of managing those symptoms that have advanced. But I'm still using the old symptoms. I still use the oregano antiviral, antimicrobial herbal extract, and that's a little effective. It helps me to reduce some of the inflammation. It helps me to clear out some of the excessive mucus produced and excreted by the organism, whether it's viral or bacterial. It's really causing, when it moves around the body, I can feel it moving as it's growing, and its excretion, when it's excreting out all the mucus, that's causing a lot of excessive swelling and tightening of the skin, especially causing head problems where the skin is tight, as you can imagine, around the head itself. On either side of the temple, it really hurts often. And around the back of the neck, where the whole neck is restricted and tightens up. But even when it sort of lessens, it still hurts to move it too much. I find I do have ways of managing the excesses of the actual pains and the strains that causes. It's just restricting my movements, really. Just finding positions that are more comfortable, that are bearable, that I can manage with, and just sort of experimenting and trying out different things at home. That I've found different breathing exercises that have helped to carry on, and also a lot of just stretching exercises as well. I use anti-inflammatories for when the inflammation gets really bad, and around the head and around the neck, and also through the lower parts of the body, where I can feel an excessive bloating. I can feel the whole muscles are squidging and sort of pushing against each other. It's this very uncomfortable, horrible feeling that there's something moving and stretching and alive inside the body. And it's feeling this bloated feeling, even though I haven't eaten excessively. And I'm trying to sort of to deal with that as it's producing more and excreting more of that mycotoxin, of whatever its mucus that it's producing is. I'm then gradually trying to push out as much as I can of that each day, and I do it through breathing and stretching exercises. I use the anti-inflammatories, and I'm also using antimicrobial, antiviral herbs that have a little effect, and they help to push out some of the excessive mucus, and that helps a little bit with me managing some of the symptoms. It's just that as those symptoms have increased, as the virus or the bacteria, whatever the infection is, as that infection has spread over the last few months, and over the last year especially, because it's been spreading in the lower parts of the body, it hasn't then spread to other parts beyond that. But it remains, and it has caused significant pains and put a lot of strain on doing things that I could do before. So I've not been able to go out regularly. I don't enjoy going out in any way because it causes Just the simple exercise of just going out, carrying a small weight or doing a small walk down the street causes a lot more pains around the side of the body, the lower body, the lungs, the neck, and around the head. And sometimes the pains are much worse if I'm getting the inflammations. And sometimes it's lesser and more manageable just to go out occasionally to a local shop. So unfortunately, at least I've been able to go out. We've got a few local pharmacists, a supermarket that's about a mile away, and a local park, that I've been occasionally, irregularly able to go out just to pick up vegetables, pain relief, various herbs and various other things, the essentials needed, medications and foods occasionally. My housemate's been getting more things, and a large bulk of the food, he's been good at getting those things in as well. And that's helped, and other people have helped with supporting me picking up other things. So it's helped when it's been quite hard having excessive pains and not knowing when I'm able to go out or not. So I've tried to sort of pick up a stockpile, so I've got a week's supply of medicine just in case I have a bad few days and I can't go out, just so the pain relief or the food doesn't run low then. So that's been a great relief. Just being able to get, a week's supply of medicine, just in case, because I'll sometimes have a bad few days when I'm not able to go out so well, and maybe a few days when I can go out to a local park, or I can talk to someone on the phone and I feel well enough. There are moments and occasions still when I can do that, and I've got to try and make the most and make the use of those, really. Well, I wanted to make a video, and a short video, I hope it's not been too long, just explaining how the symptoms have progressed over the last few months and over the last year, really, and just where I am with it at the moment. I'm using as many of the medications, the antimicrobial and the antiviral herbs and the herbal extracts, as well as the anti-inflammatories and the pain relief and the breathing exercises and the stretching exercises, just to try and cope with the symptoms of it all, really. And I'm using a lot of medicine as well to try and help to loosen the bowels. But I guess you didn't need to know that, but just because I do get blocked up because of the bloating that happens around the stomach, it makes toileting a lot harder. But I'm finding some things to help make those things easier, and just to try out more things and to cope with the symptoms, really. But my abilities and activities and movements are so much more restrictive now and are so much more limiting. Gosh, it really feels like I've aged 40 years physically, and in the last year, if I'm honest, in terms of my abilities. I haven't been this restricted since I was perhaps 13. Even then I had a bicycle, could travel many miles and go out without any pains or without any problems. It just means that everything I do, I have to do with caution and care, mindful that I'm carrying this organism in my body and carrying something that's living, that's growing, that's excreting, that's causing these pains. And just to go out when it's not so bad, and just to go out to local places, and just to go out when it's absolutely essential. If it's essential for mental health to go out, just to get a fresh change of air after weeks at home with seeing no one and having to be cooped up in the same place and, the same position, it's good. Or if I need to go out for medication or something, then just doing it because it's absolutely essential. It's just doing it in a way that I'm able to, and just doing it carefully, slowing it down, doing it differently. I'm having to learn and try to be different and not gallivant around as I could a year ago so much, and not even travel as I could a few months ago, really. I'm just struggling to adapt to it, if I'm honest, but I've got to try more. Well, I've got this hospital appointment to look forward to, and that's with hospital specialists, doctors refer me to, and so that's